You've heard it before. Exercise is good for you. But what if I told you it's more than that? What if I told you it's a legitimate prescription, a powerful medicine with almost no side effects and unlimited refills? Let's begin with disease prevention. Countless studies have shown that regular physical activity reduces your risk of heart disease, stroke, diabetes, depression, anxiety, dementia, and even certain cancers. Just 150 minutes a week, that's 30 minutes a day, 5 days a week, of moderate exercise can reduce all-cause mortality by up to 33%. It also lowers blood pressure, improves cholesterol, and decreases systemic inflammation, a root cause of many chronic conditions. Exercise makes your heart stronger and more efficient. It improves circulation, lowers resting heart rate, and boosts your body's ability to deliver oxygen to your tissues. It also enhances metabolic function. With each workout, your body becomes more sensitive to insulin, which helps regulate blood sugar and reduce the risk of type 2 diabetes. It also stimulates enzymes that help manage cholesterol and fat metabolism. Inside your brain, exercise releases feel-good chemicals like dopamine, serotonin, and endorphins. These not only boost your mood, but also enhance focus and reduce anxiety. It stimulates production of BDNF, brain-derived neurotrophic factor, a protein that helps your brain form new neural connections and improve memory. Exercise even supports hormonal balance and better sleep by regulating your circadian rhythms and lowering cortisol. And here's the best part. It's never too late to start. Whether you're in your teens or your 80s, movement provides benefits. Older adults who stay active preserve muscle mass and bone density, improve mobility, and reduce their fall risk. Kids who move more tend to do better in school, sleep more soundly, and build healthier habits for life. Across the lifespan, exercise supports resilience and vitality. Exercise isn't just for your body. It's one of the most effective, underutilized treatments for anxiety and depression. Studies show it can be just as effective as antidepressants for mild to moderate depression, especially when done consistently. When you move your body, you also reduce cortisol, the stress hormone, while increasing GABA, which calms the brain. Studies show that people who engage in aerobic exercise have lower rates of anxiety and depression, and that consistency is more important than intensity. You don't have to exhaust yourself to feel better. Even a brisk walk can have a profound impact on mood, creativity, and emotional resilience. Group classes or outdoor movement have an added benefit. Social connection and nature exposure both amplify the mental health benefits. You don't have to be a marathon runner or gym rat. Walking, biking, strength training, yoga, swimming, all count. The key is to move more and sit less. Aim for a mix of aerobic activity, muscle-strengthening exercises, and mobility work each week. For aerobic activity, aim for moderate intensity, where you can talk but not sing, like brisk walking, cycling, or dancing. For strength, 2 sessions a week of resistance training help maintain muscle mass, bone density, and metabolic health. Add mobility and stretching exercises to prevent injury and support joint health. Don't forget NEAT, non-exercise activity thermogenesis, like cleaning, gardening, or walking while on the phone. It all adds up. Common obstacles include time, energy, and motivation. But here's the truth. You don't need hours. Start with just 5 to 10 minutes a day. Build momentum with small wins. A walk during lunch, stretches in the morning, or a quick strength circuit in your living room. Overcoming the inertia of starting is often the biggest hurdle. Try the 5-minute rule. Commit to just 5 minutes. Most of the time, once you begin, you'll go longer. Keep shoes by the door, lay out your clothes the night before, or schedule workouts on your calendar as non-negotiables. If motivation is low, focus on the outcome. More energy, better mood, deeper sleep. Track how you feel after each session, not just physically but mentally. Make movement part of your daily routine. Schedule it like an appointment. Pair it with another habit, like brushing your teeth or listening to your favorite podcast. Track your progress and celebrate small wins. The more consistent you are, the more it becomes automatic and enjoyable. Behavioral science tells us that habit formation depends on three things: cue, routine, and reward. Pick a consistent time or trigger, like right after coffee, and repeat it daily. Reinforce it with something positive: a check mark on a calendar, an encouraging playlist, or a post-workout smoothie. Involve others if accountability helps. Remember, consistency beats intensity. Long-term health is built on small actions, done often. If I could bottle the effects of exercise, it would be the most powerful medication in the world. No copay, no pharmacy, just your body in motion. So here's your prescription: 30 minutes a day, 5 days a week, tailored to your ability, your interests, and your goals. People who exercise regularly tend to live longer and better. Exercise not only adds years to your life, but life to your years. Older adults who remain active are more independent, experience less joint pain, have better balance, and are less likely to fall. And it's not just physical. Cognitive health is better preserved too. Longevity isn't about avoiding death. It's about enhancing quality of life along the way. Beyond prevention, exercise is an essential part of managing chronic conditions. For type 2 diabetes, it improves blood sugar control and reduces medication need. For heart disease, cardiac rehab programs include structured exercise as a cornerstone. For arthritis, it reduces pain and improves joint function. For cancer survivors, it supports recovery and reduces recurrence risk. In short, movement is often part of the treatment plan. More and more doctors, myself included, are writing prescriptions for exercise. Not just because it's free, but because it works. Unlike medications that come with side effects, exercise has positive ripple effects throughout the entire body and mind. It's preventative, restorative, and accessible to nearly everyone, with a little creativity and support. Like and subscribe for more doctor-backed health tips from Whiteboard Wellness. And drop a comment below. What's your favorite way to get moving?